Thank you for staying with us. We have a guest with us this morning who is joining us via Zoom, and he's the Director General of the Nigeria Center for Disease Control, NCDC, Dr. Ifedayo Adetifa. Good morning, Doc. Good morning.
Good morning. Good morning. Thank you for having me.
Good to have you with us. Now, let me just give a brief introduction of what your agency is all about. The Nigeria Center for Disease Control and Prevention is Nigeria's national public health institute with the mandate to detect, prevent, and respond to diseases of public health importance. Remember COVID? Remember monkeypox? Remember Lassa fever? Yes. Since the passing of the NCDC Act, the organization has led in the management of numerous deadly outbreaks. Oh, I forgot Ebola, including Lassa fever and monkeypox, and continues to play a leading role in managing the COVID-19 pandemic. So, Doctor, only yesterday, I think it was, well, recently anyway, you sent out some advice regarding the prevention of diphtheria. How is it that we're talking about diphtheria in 2023, Doctor?
Good question. Before I answer that, just to note that monkeypox is now known as Mpox. So let's leave the monkey out of
Mpox.
The nomenclature. Okay. But you ask a very important question. And that's why we have the terms emerging and reimagined diseases. And reimagined diseases tend to be those that used to be popular or common, disappeared either because of most times frequently on account of effective vaccination programs with wide coverage. And then sometimes they reemerge when the conditions, whether population immunity dwindles or you have problems with vaccination coverage. So diphtheria is reemerging because vaccination coverage for what is otherwise a very effective vaccine has dropped to the levels where there are now what we call significant population immunity gaps. And this bacteria, which causes this disease, which is present in our environment, can now infect people and lead to symptoms and cases, which is what we're seeing at the moment. Back to you.
Doc, is it not one of the things that you get vaccinated against when you're a baby or a child?
Yes. So according to the childhood immunization program in Nigeria, we 3 doses of a diphtheria-containing vaccine are given at 6 weeks, 10 weeks, and 14 weeks to protect you against diphtheria from sort of childhood and even into your adulthood. And unfortunately, it seems like because of historical challenges with vaccination, which we are all aware of, and then more recent reductions in vaccination coverage that were probably due to the pandemic 2 or 3 years ago, we are now unfortunately seeing the outcome of a combination of those factors. Back to you.
Doctor, you need to tell us how come there's an outbreak now. Is it that mothers have stopped vaccinating the children, or what? What is the cause of it?
Well, the commonest cause at the moment, based on the cases that have been seen, is a lack of vaccination. So majority of the cases that have been seen so far in all of the states where cases have been reported have been in people who have no history of vaccination. So it's not that the vaccination stopped entirely. It's just that when you've got suboptimal vaccination coverage, what happens consequently is that you have cohorts of infants that now go back into the population grow up into adolescents and adults who don't have any protection against the target disease. When they reach a sufficient number and you have a circulating pathogen like the bacteria that causes diphtheria, then you are likely to see cases arise. And that's what it is. Unfortunately, even in some places where there may be high overall vaccination coverage, you often find that there are pockets of population, either people who are very mobile or people who have certain beliefs about vaccination, who themselves may be under or unvaccinated. And these populations then pose a high risk for disease outbreak when the pathogen is reintroduced into their setting. Back to you.
So what are the symptoms of it? And if discovered, what should one do immediately? Does it kill, by the way?
Sorry, can you repeat the last part of your question?
Does it kill? Does diphtheria kill?
Okay, so starting with the first part, the symptoms are, typically a fever, cough, runny nose, a sore throat, or difficulty in swallowing. There might be a red eye, conjunctivitis. You might also have gland swellings in the neck, and then there might be difficulty in breathing. In addition, when this has gone on for a while, you might, especially healthcare workers attending to these children or patients, may see a gray to white membrane or covering at the back of the throat, or actually, in fact, in the nostrils as well. It's, as I said, it's a vaccine-preventable disease. It has many very effective treatments in terms of readily available antibiotic that is inexpensive. For very ill patients, you require something called diphtheria antitoxin to provide treatment and to prevent death. When this is not available or this is not given because the case has not been recognized, then you can have diphtheria leading to deaths. And unfortunately, we have had quite a number of deaths so far with almost 30% case fatality since when you take all the cases together. But I mean, since the reports came and we were notified, the NCDC has made available diphtheria antitoxin, and this is now being given to the very sick patients that require them to prevent death and to shorten any suffering.
Yeah, is it
back to you?
Yeah, is it seasonal, or it's just one of those things that comes from time to time?
It is not seasonal, as I've said. The main underlying risk factor for this is that vaccination coverage has dropped, and because it has dropped over time,
I get that.
The immunity in the population has also gone down.
Yeah, I get that, doctor.
Large numbers of people who are susceptible to infection and disease.
Well, I get that, but I asked because, I mean, if it is preventable, as you have said, vaccine preventable and all, it definitely has some kind of source beyond, it being transferable to people. How do people even get away from it with or without, a vaccination? Is it possible for one to avoid contracting this diphtheria with or without a vaccine?
The bacteria that causes diphtheria is present in our environment, so we cannot get away from it, just like other things that are present in the environment. The best thing to do is prevent, which is we continue to encourage all mothers, parents of babies, of infants, to ensure that their children get all of the vaccines that are recommended as part of the childhood immunization schedule in our country. That is just the easiest thing to do. Okay. Now, when you are in a context where there's an outbreak and there are now sick people and you are likely to get exposed, then you have to ensure that people get to hospital and are diagnosed early. The use of face masks with every respiratory illness can help with protection. And then getting your patients diagnosed early and identifying yourself as a confirmed contact of cases of diphtheria means that we can also give you antibiotic prophylaxis with the appropriate antibiotic to prevent you from coming down with diphtheria.
Well,
Back to you.
I asked that question again also. Part of the reason for asking it is, I mean, since you have also said now that the bacteria that cause diphtheria are within our environment, is there a lifestyle adjustment that people need to make, environmental, work or protection that people in the various communities need to take caution, to prevent? Is it something that's prevalent in slums or in developed areas? I don't know if it's something that's related.
Well, there are no real lifestyle changes that you can make, but there are some environmental or socio-economic economic factors that predispose people to. So obviously, if you live in slum or very crowded settings, as expected, you're going to be at risk of not just diphtheria, but a lot of pathogens that cause diseases of poverty or respiratory pathogens, as the case may be. Obviously, if you're also unvaccinated, or you live in slum settings, or you live in places with poor environmental sanitation, all of these are predisposing factors, not just to diphtheria. So I know that this is the subject, but for our health in general, whether it's for diphtheria or for Lassa fever or for anything else, it's important that we live in clean environments and maintain good sanitation and hygiene in general.
Well,
back to you.
Speaking of Lassa fever, the situation report for Lassa fever that your organization, the NCDC, reported or released said that in week 52, that's December 26 to the 1st of January, there were 8,202 suspected cases, which includes 63 healthcare workers being involved also. I don't know, this is perhaps something that was expected or wasn't expected. How are we getting ahead of it? What can you tell us about this? Is there a spike that wasn't expected?
For Lassa fever, this is the Lassa fever season, and if you recall, we had earlier sent out a public health advisory alerting people to this, and outside of the news headlines, we had written to health commissioners and state epidemiologists and all of our colleagues in the states to, of course, take note that we are approaching the Lassa fever season and we expect to see a jump in cases. We plan for, we've seen Lassa fever cases throughout the year. We've got a seasonal increase in the dry season from November to May. Typically, cases peaking about the month of February. So we are seeing an uptick in cases now. It's not surprising. What we also know is that because the background rates throughout most of 2022 were higher than what we have seen in previous years, we also were anticipating that the seasonal increase might be a tad or a level higher than previously seen, and this is panning out, which is why, for example, as at by November, we had prepositioned all of sort of the materials that will be needed in terms of diagnosis, personal protective equipment, and the like, and sent this to our Lassa fever hotspots in preparation for increases in cases, and we are continuing to provide support as is needed, even now that the cases are truly accruing. Back to you.
Dr. Adejifa, isn't it a little disturbing for you? I mean, when you say that this is the Lassa fever season, I'm a little scared, for want of a better word right now, because one would have expected that the local government system would be very, very efficient in getting ahead, educating people, giving them some form of prevention, ensuring that their environments, their sanitation activities were top-notch. Growing up, you would remember that there were sanitation, officers that came to the homes, environmental sanitation officers that came to the various homes of people.
Wole, wole.
Yes, in Lagos they call them wole wole. I don't know what they call them in Zaria, in Kafanchan, anywhere else in the country. So it was what was done at the time. And I would guess that that was effective in helping people to toe the line such that these cases do not, come at all. Because I know that these deaths that we record, they are not just figures. They are human beings. They are uncles, fathers, brothers, sisters, children. And the loss of these lives is not just figures. To us, working in the maybe figures, but to these people that are affected, it's a lot of emotions that is lost. A lot of life goes with it, where even when those people are alive. So, is there a way? Isn't it a little disturbing that the local government system isn't ahead strongly enough to be able to deter these occurrences? Because these figures are jarring.
It's a very good question, but in particular, I like your the emphasis on the fact that these are lives are not numbers, and I hope that a lot more people in the media and other spaces actually look at this in that manner. So, as I've said, the advisories were sent out, and of course, because this is a recurring decimal. States and affected local governments who have primary responsibility, I assume, to the extent that it's possible, have done or started to carry out these activities. I am aware that for some of the states, at least that I've seen reports of, they had, in their defense, started the risk communication and community engagement ahead of the season, tasked local government authorities with ensuring cleanliness, and also worked, because we take a One Health approach, they've also worked closely and are still working closely with the federal, with the states, local government equivalents of the ministries of the environment and the ministries of agriculture and rural development, the animal sector, to intervene as far as the environment is concerned, to intervene possibly as far as the natural vector for this virus, the rodents are concerned. We know that across the country and in general, there is a challenge depending on where you are with water, sanitation, and hygiene. So this is not a Lassa fever problem specifically, although it contributes. And in general, there's a need for all of the relevant authorities at state and local government level, and even community level, to do more in terms of how we manage wastes, how we manage the environment, and the like. Unfortunately, in terms of, you would recall that even in the places with the cleanest environments, yes, you achieve reduction of disease, but you don't. It's difficult to achieve elimination, so you still get some occurrence of disease, and this is where other preventive methods come in. Okay. Vaccination is one of the important ones. Unfortunately, we do not have a vaccine for Lassa fever.
Well, if a country like the United States of America could eliminate malaria, I think it's only a matter of time that we would also be able to eliminate some of these diseases. But, in talking about diphtheria the other time, your organization listed Lagos, Kano, Osun, and Yobe as having recorded cases of diphtheria. Speaking for Lassa fever and cholera, which states or local governments would you say are most vulnerable or worst hit?
Most of our Lassa fever cases come from 3 states. So this is typical. This is Ondo, Edo, and Bauchi. So these are, we have Lassa fever so far in about 7 or 8 states: Ondo, Edo, Ebonyi, Bauchi, Benue, Kogi, Imo, Oyo, and Nasarawa in the period of the 1st of January to date. But most of our cases historically and currently are actually being seen in Edo, Ondo, and Bauchi states.
Doctor, we're running out of time, but we cannot have this chat with you and not talk about COVID. Recently, we heard that the numbers were increasing again abroad, and particularly in China, where the more or less 3-year lockdown was lifted. And Nigeria is one of the favorite destinations for Chinese people. But there's been no pronouncement from NCDC regarding a travel advisory or anything like that.
Good question. There have been pronouncements from the NCDC about the recent increase in COVID cases noticed elsewhere, including China. So it is important. I mean, all of the focus is on China. I mean, maybe more because of their transition from their zero COVID policy to opening up and the associated increase in cases. But there has been sort of a more widespread increase in cases in many parts of the Northern Hemisphere that are, of course, not surprising because there's a typical winter exacerbation of respiratory illnesses, of which COVID is one. And that winter exacerbation is also is expected to contribute to increase of cases even in China and other countries in the Western Pacific. But China is in the news because with their removal of a zero COVID-19 policy, it means that sort of, their population perhaps is in a place where most of the world was in 2 years ago in terms of now having open transmission of the virus in their population. But we are tracking the increases in COVID in all of the places where they are being seen in the United States, in the South American subcontinent, in parts of Europe, and of course in China. We're also tracking, of course, the new Omicron descendants that are causing, in terms of variants of the SARS-CoV-2 virus that are associated with some of these increases, especially the XBB 1.5, which is circulating in the US and many parts of Europe. In terms of the viruses circulating in China, based on the information that is available, these are viruses that these are variants that have been seen in other parts of the world already for more than a year, even including in Nigeria. And at the time those variants were seen in Nigeria and South Africa, in other parts of Africa where flights come to us, they were not associated with any increases in cases or any wave. So while we've made pronouncements on this subject, we have not made any pronouncement on travel at the moment because there is no evidence to make any changes to travel. As you would recall, the Omicron first emerged on the scenes about late 2021. And also we had that fourth wave in Nigeria in general. What we know from that period is that in situations like this, all this country-specific targeting of either PCR testing or all of that don't actually have or didn't have any impact on Omicron specifically. And all of the variants we're dealing with at the moment are Omicron babies. Yes, they are more transmissible. We do not have any evidence that they cause more severe disease. Okay. And we do not have any evidence that what's going on in the US or in Europe or in China at this point is anything beyond what is expected. So we continue to watch and we continue to conduct surveillance. And if there's any need to take proactive actions, we will recommend those and implement them as well.
Doctor, we've run completely out of time, but in closing, do we need to pay any particular attention to this? Do we need to go back to wearing our masks in public places or what?
Well, we advise that if you are in the high-risk group for COVID in general, regardless of what's going on in other parts of the world, if you are elderly, if you have underlying chronic diseases, hypertension, diabetes, or the like, if you have any problems with your immune system, you are an organ transplant recipient, you are receiving cancer treatment or anything that compromises your immunity, please use a mask in public, use a mask in crowded spaces, and then more importantly, please get your COVID vaccines, including all of your booster doses.
Boosters. Thank you very much. Dr. Ifedayo Adetifa, Director General, Nigeria Center for Disease Control. He was our special guest on Sunrise this morning. Thank you very much, Doctor.
Thank you for having me.
The lifestyle segment is next. What are we talking about today?
Well, we've been talking about people losing loved ones and all of those things. How do you deal with that?
See you shortly.